Hi, good evening. Welcome to Monday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. So, how was your weekend? എങ്ങനെയുണ്ടായിരുന്നു weekend ഒക്കെ? And we had an exam. Yeah, we have an exam, right, on this Saturday. So, how's your preparations going? എങ്ങനെ പോകുന്നു preparations ഒക്കെ? Anyway, so let me check how many of you have joined this live segment. So, before that, let me know anybody is watching this live segment, those who have exam this week, ഈ ആഴ്ച എക്സാം ഉള്ള ആരെങ്കിലും വാച്ച് ചെയ്യുന്നുണ്ടോ ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? And as you guys know, this is a virtual classroom, right? So the only thing which I can do to respond is that through your comments. So don't hesitate to post your comments here. So please do comment. Yes, good evening once again. Yeah, so in this video, I'll be dealing with, it's a self-prepared material for part A. So let's read the material. I'll tell you how we can do part A within 8 minutes of time. And then we will dive into the question sessions. Clear? Okay. So let me know in the comment box, yes, how many of you have joined? Yeah, so we had some technical glitches before, that is the reason. Anyway. Okay, so how are you all? All right. So the material which we have, which is GAE. I'll read the material. So today I'm going to discuss part A in very detailed manner so that you can understand that how you can do part A within 8 minutes of time. And as you guys know, the time that you will get to do part A is only 15 minutes. But through, as I'm always saying, through your practice, through your hard work, definitely you can do part A within 8 minutes. And it's not about hard work matralla. And it's always regarding smart work also, right? Yes. So that is reading. Yes. Anyway, I'm coming to this material. So I'll start with the connection, or what is your how your day-to-day activities connected to part A. എങ്ങനെയാണ് നിങ്ങളുടെ day-to-day activities part A ആയിട്ട് നമുക്ക് കണക്ട് ചെയ്യാൻ പറ്റുക. As well as in this video, I'll just discuss about what is the method or what is the strategy we are applying in part A. Then let's discuss the questions. Clear? So part A, as you guys know, it's all about 15 minutes. Part A എന്ന് പറയുന്നത് 15 minutesലാണ് നമ്മൾ ചെയ്യുന്നത്. And we have 20 questions in part A, total 20 questions in part A. So as you know, 15 minutes and 20 questions, right? Then, and always I know that majority of the students are facing some difficulties in doing part A because of time management. So that is the major, or I can say the foremost thing said by them. So അവർ പറയുന്ന ഒരു ഇമ്പോർട്ടൻറ്റ് കാര്യം എന്ന് പറയുന്നത് മാം ടൈം മാനേജ്മെൻറ്റ് ഇല്ല, അല്ലെങ്കിൽ ടൈം കിട്ടുന്നില്ല എന്നുള്ളതാണ്. So what I have to say is that if you guys are practicing a particular material or a lot of materials, understand first of all what is reading. നിങ്ങൾ റീഡിങ് എന്താണെന്നുള്ളത് ആദ്യം തന്നെ അണ്ടർസ്റ്റാൻഡ് ചെയ്യുക. വിത്തൗട്ട് അണ്ടർസ്റ്റാൻഡിങ് what is reading, you cannot complete part A. Clear? So that I'll start with the reading. Okay, so we have two different types of reading which I'm specifically saying. Active reading and passive reading. So what is active reading or what is passive reading? Active reading, which means we need to know regarding the matter which is given in the text. നിങ്ങൾ എന്താണോ വായിക്കുന്നത്, whatever you're reading, we have to understand, we have to grasp, we have to comprehend whatever we are reading, and this is a process of cognition. And the other one is passive reading. For example, if you know the language, if you know the words, if you can read whatever you want, that's called passive reading, just for a time pass. That is called passive reading. Clear? So active reading, which means we are just reading for understanding, and whereas passive reading, which means just for time pass. Okay, it's for nothing, just to for example, if you guys are traveling to somewhere, you can read the boards, you can read the posters. So likewise, whatever we are reading, if you know the language, that's called passive reading. But whatever you're reading to understand something, that is called active reading. So as a module, reading as a module, we have active reading here. I'm going to active reading aanu vendathu alle. Yes. So, in this particular module, I mean reading module, we have 3 different parts. Like 3 different parts are namukkulladu. Part A, Part B, Part C. So, today we are going to talk about Part A in detail. Then, what do you guys know about Part A? As I already mentioned, Part A, it's all about 15 minutes as well as 20 questions. But this 20 questions, it doesn't, look like a stretch of questions. It can be divided into 3 different sessions. 3 different sessions are divided ചെയ്തിട്ടുണ്ട്. And the first 1 to 7 set of questions that can be called match the following questions. Okay, ആദ്യത്തെ 3 first 7 questions എന്ന് പറയുന്നത് not 3. The first 7 questions can be called match the following questions, and the 8 to 14 set of questions that can be called short answer questions, and the rest of the questions, which is 15 to 20, can be called what? Fill in the blanks. Clear? So, if you guys felt that part A is very difficult to do because of the time management, I'll just give you a technique. Clear? For example, your exam is on next week. But your exam you just started reading today. And what you can do is, you can set a timetable, or you can set a schedule for doing materials regarding Part A. And today, it is Monday, you can take Part A material. Then read Part A without setting the timer. Clear? So you can read Part A without setting the timer. Timer only set the Part A vaikya. Underlining the words which is unfamiliar for you. നിങ്ങൾക്ക് അറിയാത്ത കുറച്ച് വേർഡ്സ് ഉണ്ടെങ്കിൽ അതെല്ലാം അണ്ടർലൈൻ ചെയ്യുക. ആൻഡ് ഐഡൻറ്റിഫൈ ദ മീനിങ് ഓഫ് ദോസ് വേർഡ്സ്. ആ വേർഡ്സിൻ്റെ മീനിങ് നിങ്ങൾ നോട്ട് ചെയ്യുക. So that you can take a book and you can write that unfamiliar words which you have found and just study the meanings. Clear? And read the questions. Then definitely you can find out the answer because you have not set the time and you guys are reading thoroughly. So definitely you can find out the answer. On the very next day, you can set the timer, plus you can do an additional material without setting the time. I'm talking about Part A only, right? Yeah. So, on the very next day, you can set the timer for another material Part A, and you can do one more additional material without setting the timer. And continue this procedure till the last day of your exam. Our exam ante thale divasam vare idu thanne continue cheya. So, definitely if Part A is difficult for you, definitely you can score in Part A. Clear? Then, we are applying a method in Part A. നമ്മളൊരു മെത്തേഡ് വെച്ചിട്ടാണ് ആക്ച്വലി പാർട്ട് എ ചെയ്യുന്നത്. all other parts we are just doing with the help of a particular strategy. And in Part A, what is the strategy we are using? I can say that strategy that's called skimming and scanning method. And skimming is not a very easy procedure to do. ഇത് അത്ര ഭയങ്കര ഈസി ആയിട്ടുള്ളൊരു കാര്യമല്ല. Definitely skimming needs a lot of practice. Clear? And skimming, which means fast reading. Just think. Okay, for that you can understand your level of reading. You can take a material. For example, you can take a newspaper cutting. Newspaper cutting edukka. Or you can take a book, whatever book, a novel or something, whatever. You can take it and read. At least you can set a 5-minute time. Or 5-minute time set cheya, or timer set cheya. Then start reading. Okay, and then you can analyze. Okay, so after this 5 minutes, or exactly 5 minutes, when it's 5 minutes, you can check your reading level. Okay, 5 minutes കൊണ്ട് നമ്മൾ എത്ര പേജ് കവർ ചെയ്തു, അല്ലെങ്കിൽ എത്ര പാരഗ്രാഫ്സ് കവർ ചെയ്തു. Within this 5 minutes of time, how many pages you have covered, or how many paragraphs you have covered. Clear? So within 5 minutes, actually, if you are a fast reading, or if you're doing fast reading, definitely you can complete over 4 pages. ഒരു 4 പേജ് വായിക്കാനുള്ള ടൈം ഉണ്ട്. ഇഫ് യു ആർ എ ഫാസ്റ്റ് ലേണർ, ഐ മീൻ ഫാസ്റ്റ് റീഡർ, അത്ര സ്പീഡിൽ വായിക്കുന്ന ഒരു റീഡർ ആണെങ്കിൽ വിത്തിൻ 5 minutes you can complete maximum 4 pages. Clear? So that is how you are practicing, or how you have to practice. If you're not able to do that, again set 5 minutes. Practice the same thing daily. If you guys are not practicing, I'm so sorry to say this, you cannot complete this. Clear? So please do practice fast reading every day. It will help you to do the material, complete the material within 20 minutes of time. 15 minutes of time. Clear? Then, first of all, when you read it for the first time, നമ്മൾ ആദ്യമായിട്ട് പാർട്ട് എ വായിക്കുന്ന സമയത്ത്, if you guys are applying fast reading or skimming method, you will not understand any single thing. നിങ്ങൾക്ക് ഒരു അക്ഷരം പോലും മനസ്സിലാവില്ല. And don't ever think that, okay, I'm not a very good learner, or I'm not a very good reader. It's not, because it's not your fault. This is just usual. It's a natural thing. ക്ലിയർ. നമ്മൾ ആദ്യമായിട്ട് നമുക്കറിയാത്ത ഒരു ടെക്സ്റ്റ് വായിക്കുകയാണ്, അല്ലെങ്കിൽ നമുക്ക് ആദ്യമായിട്ട് അറിയാത്തൊരു കാര്യം ചെയ്യുമ്പോൾ ഇറ്റ് വിൽ ബി വെരി ഡിഫിക്കൽട്ട് ഫോർ us. നമുക്ക് ഭയങ്കര ബുദ്ധിമുട്ടായിരിക്കും. ബട്ട് ഇഫ് യു ആർ പ്രാക്ടീസിങ് ഇറ്റ് ഡെയിലി, ഡെഫിനറ്റ്ലി വിൽ ബി വെരി ഈസി ഫോർ യു. ക്ലിയർ? യെസ്. സോ പ്ലീസ് ഡു റീഡ് ഫ്രം ടുഡേ ഇറ്റ് സെൽഫ്. ഇപ്പോൾ നിങ്ങൾ വായിക്കാൻ തുടങ്ങിയിട്ടില്ലെങ്കിൽ ഇറ്റ്സ് ഓക്കെ. We have time, so please do read today itself. And when you read something, underline the unfamiliar words, find out the meaning from the Google and study it. Definitely, if you guys are practicing so, you can score above 400. Trust me. Clear? So that's all about reading habit. Then coming to part A, I was talking about the strategies, that's skimming and scanning method, right? So what is skimming? Fast reading. And what is scanning, which means searching. We are just searching for some important words from the text. നമ്മൾ ടെക്സ്റ്റിൽ നിന്ന് കുറച്ച് ഇമ്പോർട്ടൻറ്റ് വേർഡ്സ് നമ്മൾ സെർച്ച് ചെയ്യുകയാണ്. ആൻഡ് വെൻ യു സെർച്ച് ഫോർ ദ ഇമ്പോർട്ടൻറ്റ് വേർഡ്സ് ഫ്രം ദ ടെക്സ്റ്റ്, ഇറ്റ് നീഡ്സ് എ പെർട്ടിക്കുലർ കൈൻഡ് ഓഫ് സ്ട്രാറ്റജി. Okay, and majority of the students are not able to understand what are the important words that they can underline. But I'll tell you what are the words that you can underline. And for that, I'll give you a strategy. And first one, when you read a particular text, for example, text A, B, C or D, you can underline all the heading. And the most important thing, don't skip a line. Oru line pole nammal skip cheyarudhu. You have to read each and every line by line reading. Clear? And whatever it is, if it is a table, if it is a diagram, a flowchart, whatever it is, we have to read it line by line. But when you read it, the method's called, you can use a method called fast reading. Don't do slow reading. That is the reason why you cannot do the material or this particular 20 questions within 15 minutes. That's the reason. So you can practice fast reading. Yes. Hi Anu, good evening. Yes, Sibi, good evening. Beulah, good evening. Yes, I'm good, dear. What about you? Yes, Ashwati, good evening. Yes, Nimi, good evening. Hi Kavita, after a long time, how are you? Good evening. Yes, Rosemaria, good evening, dear. Yes, how are you? Yes, Arya, good evening. Yes. Okay. Yeah, so good evening, everyone. Anyway, we were discussing about part A. But the most important thing is that don't ever think that, okay, I know reading. Enike reading ariyam. So reading is not a very difficult job for me, but it is. Okay, so don't be so overconfident. You can start with part A. So completely focus on reading. If reading is, whatever I'm trying to say is that if reading is difficult for you, reading the module difficult, you can focus on reading. Clear? So start with part A. And just imagine, why we are doing part A. The most important thing is part A is going to analyze whether the student is able to do a certain procedure within a period of time. ഒരു കാര്യം കൊടുത്താൽ ആ ഒരു പർട്ടിക്കുലർ സ്റ്റുഡൻറ്റ് അല്ലെങ്കിൽ ആ ഒരു ആസ്പിരൻറ്റ് ഓർ ദാറ്റ് പർട്ടിക്കുലർ സ്റ്റാഫ് ഇസ് ഏബിൾ ടു ഡു ദാറ്റ് തിങ്. അത് ചെയ്ത് തീർക്കാൻ അവർ ഏബിൾ ആണോ? ദാറ്റ് ഈസ് ദ സെയിം തിങ് വി ആർ ഡൂയിങ് ഇൻ പാർട്ട് എ. ക്ലിയർ? ആൻഡ് ഫോർ ദാറ്റ് ദേ വിൽ ഗിവ് യു 4 ഡിഫറെൻറ്റ് ടെക്സ്റ്റ്. കണ്ടോ, 4 ഡിഫറെൻറ്റ് ടെക്സ്റ്റാണ് തന്നിരിക്കുന്നത്. ടെക്സ്റ്റ് എ, ടെക്സ്റ്റ് ബി, ടെക്സ്റ്റ് സി ആസ് വെൽ എസ് ടെക്സ്റ്റ് ഡി. ക്ലിയർ? ആൻഡ് യുവർ ടാസ്ക് ഇസ് ദേ വിൽ ഗിവ് യു 20 questions പ്ലസ് ദിസ് 4 text and 15 minutes. So they are just analyzing whether the student is able to finish 20 questions within 15 minutes of time. That is a skill. അല്ലേ? ഇപ്പോൾ ഒരു സ്കിൽ എന്ന് പറയുന്നത് maybe we have the skill called reading. നമുക്ക് റീഡിംഗ് എന്ന് പറയുന്ന ഒരു സ്കിൽ ഉണ്ടാവും. ബട്ട് വാട്ട് വി ഹാവ് ടു ഡു ഇസ് വി ഹാവ് ടു പോളിഷ് ഇറ്റ്. നമ്മളത് എപ്പോഴും പോളിഷ് ചെയ്തുകൊണ്ടിരിക്കണം. So when you polish something, the beauty will increase, right? So likewise, when you practice daily, definitely it will be very easy for you. Clear? So that is why I'm always saying practice. It's very important. Okay, നമ്മൾ എല്ലാ ദിവസവും അത് പ്രാക്ടീസ് ചെയ്തില്ലെങ്കിൽ it will be very difficult for you to do the task. Maybe നമുക്ക് ആൻസർ അറിയായിരിക്കും. ഫോർ എക്സാമ്പിൾ, വൺ ഓഫ് മൈ സ്റ്റുഡൻറ്റ് ടോൾ മീ ദാറ്റ് മാം, ഞാൻ ആൻസറൊക്കെ ചെയ്തിരുന്നു, ഐ എം വെരി കോൺഫിഡൻറ്റ് ഇൻ റീഡിങ്, ബട്ട് ദ പ്രോബ്ലം ഇസ് ദാറ്റ് വെൻ ഐ റെഡ് സംതിങ്, അല്ലെങ്കിൽ ഞാനത് വായിച്ചുകൊണ്ടിരുന്നപ്പോൾ ഐ ജസ്റ്റ് അണ്ടർലൈൻഡ് എവറിഥിങ് കറക്റ്റ്ലി, ബട്ട് ഐ ഡിഡൻറ്റ് ഗെറ്റ് ദ ടൈം ടു ബബിൾ ഇറ്റ്. ഓക്കെ, ഇപ്പോൾ പാർട്ട് ബിയും പാർട്ട് സിയും ചെയ്യുന്ന കുട്ടികൾക്ക് പറ്റുന്ന ഒരു മിസ്റ്റേക്കാണ്. അതെല്ലാം വായിച്ചു, അണ്ടർലൈൻ ചെയ്തു, കറക്റ്റ്ലി ഐ ഹവ് ഡൺ എവറിഥിങ്, ബട്ട് ദ പ്രോബ്ലം ഇസ് ദാറ്റ് എന്ത് ചെയ്തില്ല, ഐ ഡിഡൻറ്റ് ബബിൾ ഇറ്റ്. ഞാനത് ബബിൾ ചെയ്തില്ല because I didn't get the time. So don't wait for it. Whenever you read a question, along with reading, underline the keywords. Then read whatever you want, maybe the paragraph or the options. Then when you get the correct answer, always bubble the answer. I'm talking about B and C, okay? Yeah. So don't wait for the time. Clear? Yes. Hi Manju, good evening. Yes. So that's that. And the most important thing is that in reading, ഇപ്പം നിങ്ങൾ ചോദിക്കും ഞാൻ എത്ര ചെയ്തിട്ടും എനിക്ക് റീഡിങ് അങ്ങോട്ട് മനസ്സിലാവുന്നില്ല, വാട്ട് ഈസ് ദ പ്രോബ്ലം ബിഹൈൻഡ് ദാറ്റ്? ഐ എം ജസ്റ്റ് അവിടെ നമ്മൾ നിൽക്കുക എവിടെ 310 or 300, മൈ സ്കോർ ഇസ് നോട്ട് ഇംപ്രൂവിങ്. വാട്ട് ഇസ് ദ റീസൺ? ജസ്റ്റ് തിങ്ക് അബൌട്ട് ഇറ്റ്. നമ്മൾ എന്തുകൊണ്ട്, വൈ ഐ എം നോട്ട് ഗെറ്റിംഗ് എനി ഇംപ്രൂവ്മെൻറ്റ് ഇൻ റീഡിങ്? അത് നമ്മളോട് തന്നെ ചോദിക്കാം. ആസ്ക് യുവർ സെൽഫ് വൈ. ടെൽ മീ വൈ. നിങ്ങൾ വായിക്കുന്നത് പോരാഞ്ഞിട്ടാണോ? ഇസ് ഇറ്റ് I mean, whether you guys are thinking that your reading is not enough, അത് പോരാൻ തോന്നുന്നുണ്ടോ? Or is it because of time management? പക്ഷെ നമ്മൾ ചോദിക്കുക, ഓക്കെ ഞാൻ എഫേർട്ട് എടുക്കുന്നുണ്ടോ? Is it enough, my effort? If it is no, then take effort. അല്ലേ? ഇപ്പം നമ്മുടെ സൈഡിൽ നിന്ന് നമ്മൾ കാര്യങ്ങൾ ചെയ്യുന്നില്ല എന്നുണ്ടെങ്കിൽ ബാക്കി നിങ്ങളുടെ ട്രെയിനേഴ്സോ അല്ലെങ്കിൽ എന്തൊക്കെ നമ്മൾ ചെയ്തിട്ടും there is no use. So the first thing is start within us. നമ്മളെന്ന് സ്റ്റാർട്ട് ചെയ്യുക. Okay? So take a book for that, for reading. And whenever you read something, collect some words that is unfamiliar for you. Find out the meaning and study the meaning. ഒരു റീഡിങ് ഇഷ്ടമുള്ള ഒരാൾ ചെയ്യുന്ന കാര്യമാണ്. Whenever they read something, they will notice some unfamiliar words. ചില അൺഫെമിലിയർ വേർഡ്സ് കാണുമ്പോൾ നമുക്ക് തന്നെ ആ ദാറ്റ് കൈൻഡ് ഓഫ് തേഴ്സ്റ്റ് എന്നൊക്കെ നമ്മൾ പറയത്തില്ലേ, ഇത് എന്താണ്, വാട്ട് എവർ ദാറ്റ് എക്സ്പെക്ടേഷൻ ഓർ ദാറ്റ് കൈൻഡ് ഓഫ് എന്താണ് അതിൻ്റെ മീനിങ്, വാട്ട് ഇസ് മീനിങ് ഓഫ് ദറ്റ് വേർഡ്? ഐ ഹാവ് നോ ഐഡിയ ദിസ് വേർഡ്, ദിസ് ഇസ് ദ ഫസ്റ്റ് ടൈം ആൻഡ് ഐ എം ജസ്റ്റ് സീയിങ് ദിസ് വേർഡ്. സോ എന്താണ് ആ മീനിങ്, വാട്ട് ഇസ് ദ മീനിങ് ഓഫ് ദറ്റ് വേർഡ്? ദറ്റ് കൈൻഡ് ഓഫ് ഈഗർനെസ് ഇസ് ദെയർ. സോ ലൈക്ക്വൈസ് we should underline the unfamiliar words and practice fast reading. Okay? So that is skimming and scanning, which means fast reading plus underlining important words from the text. Clear? Yeah. Then, what is another important thing in reading? When it comes to part A. The second thing is that, as I already mentioned, we have a 13 keyword strategy to underline the important words from the text. Clear? So this is kind of a tip which I am giving you. ഇതൊരു ടിപ്പ് പോലെയാണ്. Because majority of the students have no idea how to underline the keywords. Keywords എങ്ങനെ അണ്ടർലൈൻ ചെയ്യണം, അതായത് ഇമ്പോർട്ടൻറ്റ് വേർഡ്സ് എങ്ങനെ മാർക്ക് ചെയ്യണം, അവർക്ക് അതിനെപ്പറ്റി അറിയില്ല. So for that you can do a technique. So that I'm giving you a tip. എന്താ? You can use a 13 keyword strategy. So for that, first of all, you can underline all the headings. എല്ലാ ഹെഡിങ്സും മാർക്ക് ചെയ്യുക. ഹെഡിങ്സ് എന്നിട്ടുണ്ടെങ്കിൽ ഹെഡിങ്സ് മാർക്ക് ചെയ്യുക. And the second thing is that you can underline all the subheadings. തന്നിരിക്കുന്ന എല്ലാ സബ് ഹെഡിങ്സും അണ്ടർലൈൻ ചെയ്യുക. ആൻഡ് ദ തേർഡ് തിങ് ഇസ് ദാറ്റ് you can underline all the numbers. Whatever numbers they have mentioned, mark all the numbers. എല്ലാ നമ്പേഴ്സും വളരെ കൃത്യമായിട്ട് മാർക്ക് ചെയ്യുക. Maybe they will mention the numbers in figures as well as in words. So whatever it is, mark all the numbers, underline all the numbers. Because why I'm saying this, definitely they will ask you questions regarding the numbers. How many subjects are there? How many students were there? So likewise, how many type of questions, so that if you need to find the answer, you should underline the numbers, right? Yes. Then fourth one, signs and symbols. Majority of the time I can see a lot of signs and symbols in the text, so that please underline the signs and symbols. For example, less than, equal to, greater than, percentage. So likewise, mark all the signs and symbols. Then all the names, പേരുകൾ ഉണ്ടാവും, nouns. Right? Maybe name of a person, ഒരാളുടെ പേരായിരിക്കും. Maybe name of a disease condition like this, GAE. I mean, that is an abbreviated form, yeah, whatever. So maybe name of a country, name of a procedure, medicine. So whatever names they have mentioned, underline all the names. Then underline all the abbreviations. Abbreviations, for example, this. Short forms. Then underline all the brackets. The brackets are kondam. So likewise, you can underline all the brackets, because definitely they can ask questions from the bracket as well. Clear? Then underline bold and italicized words. Sometimes they will mention bold words as well as italicized words in between the paragraphs. You can underline that. And the next thing is that I can say some words which are important related to time. Time kanikkinna chala words bhayankara important aanu. For example, I can say now, yesterday, morning, nocturnal, night, previously, Currently, presently, before, after. So likewise underline all the words that indicate time, because definitely one of the questions from short answer questions that contain when it happened, when it was introduced. So likewise the question regarding when will be there. So if you want to answer the questions correctly, you need to write the word which indicate time also. For example, when it was introduced in 1947. Clear? Yeah. And another important point, you can underline the words which indicate experiment. Experiment related ആയിട്ട് words നമ്മൾ കാണും. When you read part A, you can see a lot of words which can be connected with experiment. For example, diagnosis, test, procedure, lab, identification, examples. So likewise experiment related words will be there. And next one is the words that indicate research. Research related words. Research, researcher, population, aspect, study, the circle, exclusion, inclusion, outcome, result. See, a lot of words. As well as the first and last line. Definitely part A, text A, B, C and D will be in paragraphs, and one of the text will be a pictorial of something, right? So if you want to underline certain things, always know that this first and last line of each and every paragraph is always important. So I'm not asking you to underline it, okay, but you can just read it very thoroughly. കുറച്ചും കൂടി important ആയിട്ട് അത് വായിക്കാം. And the final thing is that you can underline all the bullet points. Clear? So likewise we are underlining the keywords from the text. This is just an overall idea regarding part A. Clear? And now we are just moving to the question answer sessions. As I already mentioned, 1 to 7 is match the following, and 8 to 14 fill in the short answer questions, and 15 to 20 fill in the blanks. Clear? Then, so I'll show you what is skimming and scanning method through this particular text GAE, and you can underline the words according to that 13 keyword strategy which I've already given you, and then we will discuss the answers. Clear? Yes. Hi Ganga, good evening. Yes. So I'm going to read it. So please do underline the keywords from the text. Yes. Balamathia mandrilaris, a free living amoeba. It's a very difficult term to pronounce actually. It's not like what you have seen. നിങ്ങൾ കാണുന്ന പോലെ അല്ല ഇത് പ്രൊനൗൺസ് ചെയ്യുന്നത്. It's a little bit different. It's actually Balamathia mandrilaris. Okay. As a free living amoeba. So I'm just underlining the word that indicates the name of a particular thing. An amoeba. Found in the environment. It is one of the causes. One, see? Number. Causes of granulomatous amoebic encephalitis, that is GAE, a serious infection of the brain and spinal cord. Then Balamathia is thought to enter the body when soil containing Balamathia comes in contact with the skin, wounds and cuts, or when dust containing Balamathia is breathed in or gets in the mouth. The Balamathia amoebas can travel to the brain through the bloodstream and cause GAE. So these are my keywords from the first para. Clear? Then scientist, the name of a particular group of persons. At the Centers for Disease Control and Prevention CDC first discovered Balamathia mandrilaris in 1986. The amoeba was found in the brain of the dead mandrill baboon. After extensive research, B. mandrilaris was declared a new species of amoeba in 1993. Since then, more than 200 cases of Balamathia infection have been diagnosed worldwide, with at least 70 cases reported in the United States. Little is known, little which means nothing, is known at this time about how a person becomes infected. Balamathia has been found in dust and soil in many places around the world. It is possible that Balamathia may also live in water. Clear? So these are my keywords from text A. Then I'm moving to text B. The symptoms of B infection. I'm just reading it like B infection, okay? can begin with skin wound on the face, chest, torso, arms or legs. The infection involves the brain. The disease it causes is called granulomatous amoebic encephalitis, that is GAE. Some early symptoms might include headaches, stiff neck or head and neck pain with neck movement, sensitivity to light, nausea, vomiting, lethargy or tiredness, low-grade fever. The disease might appear mild at first but can become more severe over weeks to several months. Often the disease is fatal. GA is chronic and symptoms develop over a period of several weeks to as long as 2 years, with a death rate of more than 89%. Overall, the outlook for people who get this disease is poor, although early diagnosis and treatment may increase the chances of for the survival. So these are my keywords from text B. And I know text A is all about what is this disease condition and how it is transferable. And text B is all about what are the symptoms of this particular disease condition. Now I'm just jumping to text C. GAE is often diagnosed only after death. However, it can be diagnosed by examining tissue samples from living patient as well. Diagnosis of GAE in living patient is less common because the amoebas are difficult to identify under microscope, even with commonly used strains. However, there are 3 types of tests can help confirm the diagnosis of GAE. The indirect immunofluorescence assay or IFA is a test used to detect antibodies developed against Balemnitia or B amoebas in the serum of infected patients. In contrast, immunohistochemistry or IHC and indirect immunofluorescence, that is IIF, staining use specific antibodies against B to detect the amoebas. Finally, polymerase chain reaction or PCR molecular assay can detect Balemnitia DNA, especially in brain tissues. CDC offers diagnostic assistance for Balemnitia to physicians and scientists through DPDX and the free living and intestinal amoebas, that is FLIA laboratory. Then morphology experts at DPDX can evaluate microscopic images, while the scientists at the FLIA laboratory provide diagnostic assistance using molecular and immunofluorescence assays. That's all about text C, and it's all about a kind of technique or some diagnostic procedures we can take to look for this particular amoebas or something. Yeah. And text D, it's a pictorial. So as you guys know, one of the text will be a pictorial of something, right? Yes. And a lot of numbers mentioned here. On the left side, there is 3 different boxes, and on the right side, I think there are 1, 2, 3, 4, 5. Yeah, 5 different boxes. So the first box from left side, 65 cases excluded by case definition or as non-encephalitis. 268 cases of suspected encephalitis. Then 111 cases diagnosed by first line testing, that is 55%. 203 encephalitis cases, 100%. Then 17 cases diagnosed following expert review panel advised, 8%. 92 cases with unknown etiology, 45%. 75 cases with unknown etiology, that is 37%. Then 25 cases had exhaustive testing, 36 cases to pathogen discovery by metagenomics and next generation sequencing. So these are my keywords from this pictorial. Clear? I hope it is clear how I have underlined the keywords from this particular different text through scanning method. Okay, so now I'm just going to the question answer sessions. So the first question, and please let me know in the comment box your answers as well. And once again, I'm reminding you guys, this is the only the method to reach into your comments. It is only through this live segment. So please do respond. Please do post your comments here. Clear? Yes. First one. And when you read a question also, you can underline some keywords from the question, and I can say maximum 3 keywords, not more than 3. Yes. So the first one, enumerate the initial indications of Balemnitia infection. So my keywords, enumerate initial indications. So indication, which means symptoms. And if you are a student who are doing daily exercises for part A, or if you're a student who is attending my live segments every day, definitely you will know what is the synonym for the word indication. That means synonyms. Clear? So let me know in the comment box what is your answer for question number 1. The question answer on the comment ede. Yes, let me know in the comment box what is your answer for question number 1. On the comment ചെയ്യാമോ എന്താണ് ഫസ്റ്റ് ക്വസ്റ്റ്യൻ്റെ ആൻസർ എന്ന്? What is your answer for question number 1? Yes. Yes. Hi, Shanu. Yeah, any other answers? Shanu got the correct answer. Yes, Shanu, it is from text B. Because you don't even have to check, right? Because already I've read it very clearly. So the symptoms mentioned, early symptoms mentioned in text B. So that is from text B. So we have some symptoms mentioned here. See, some early symptoms might include headache, stiff neck, sensitivity to light and dash. So answer is from B. A lot of correct answers I can see. Thank you so much for your effort, because you guys are commenting it here. So thank you so much once again for your active participation. Yes, Veena. Hi Veena, it's B. Yes, Kavita, it's B. Yes, Asha, B. Anju. Yes, Anju. Shaimol, Sneha. Yes, Sneha. Agnes. Hi, Agnes. All my students are here, right? All right. Yes, Neethu, Anju, Jaina. Answer is mentioned in text B. And second one, why is it challenging to detect GAE in living organisms? So my keywords, challenging and detect living organisms. So I'm not going to underline a lot of words or a group of words, just organisms. Clear? So challenging, detect organisms. So where is it mentioned? It is challenging, detecting organisms. Detecting, which means to identify, diagnose. So diagnosis of this condition is mentioned in, just imagine, that is mentioned in. Yes, very good, Nimmi. Answer is C. Clear? Which is from text C. Diagnosis, detection of GAE in living patient is less common because of amoebas are difficult to identify under the microscope even with commonly used strains. So that means answer is mentioned in text C. Yes, and again Neethu, yes, Beulah, yes, Anju, Asha, Shanu, Nimmi, yeah. Yes, Sona, first one is B. Yes, Josely, Neethu. All right. A lot of correct answers. Very good. Cystolin, yes, Cystolin. Yes, it is C. Third one, the projected mortality rate associated with GAE. Projected mortality and GA, or you can underline rate. Okay, whatever it is, underline 3 individual keywords from the question. Again, I'm just thinking about projected mortality, GAE. Any guys, where is mortality mentioned, death cases mentioned? And I think from reading those keywords and underlining those keywords, I've underlined something regarding death from, I think from text B, right? Okay, what is your answer, guys, for third question? Yes, Asha, Anju, it was from, yeah. Is it from text D, death cases? എവിടെയാണ് ഡെത്ത് കേസ് പറയുന്ന ഡിയിൽ? വെർ ഇസ് ഡെത്ത് കേസസ് ഇൻക്ലൂഡഡ് ഇൻ ടെക്സ്റ്റ് ഡി? എവ്രിബഡി ഈസ് കമൻറ്റിങ് ടെക്സ്റ്റ് ഡി. ആർ യു ഗൈസ് കോപ്പിങ്? കോപ്പി ചെയ്യണോ? ഇറ്റ്സ് നോട്ട് ഇൻ ടെക്സ്റ്റ് ഡി. യാ, തേർഡ് വൺ ഈസ് ഇൻ ടെക്സ്റ്റ് ബി. ബി ഈസ് ദ കറക്റ്റ് ആൻസർ. ഓക്കെ, ബി ഈസ് ദ കറക്റ്റ് ആൻസർ. പ്രൊജക്റ്റഡ് മോർട്ടാലിറ്റി റേറ്റ് ആണ് ചോദിക്കുന്നത്. മേ ബി ദ റേറ്റ് വിൽ ബി ഇൻ പ്രൊപ്പോർഷൻ, ഓർ ഐ കൻ സേ percentage or something. Let me check എവിടെയാണ് പെർസെൻറ്റേജോ അല്ലെങ്കിൽ റേറ്റ് കൊടുത്തിരിക്കുന്നത്. Actually, it is all about some symptoms regarding this condition, but in the second last line you can very clearly see with a death rate of more than 89%. See, that is the correct answer. If you are a student who already underlined all the numbers, definitely you will get the correct answer, right? Yeah. So why it is wrong? It's not D, it is B. B on it. Yes, Kavita, Anju, Jaina, Agnes, Nimmi, Cystolin. Yeah, it was from text B. Fourth one, mechanism of transmission of Balimatiae mantralaris. So my keywords, mechanism and transmission, because I'm not underlining the words. That is as the title itself, or this particular text is all about that infection. So mechanism and transmission. Transmitting the disease condition through some kind of environment, soil. Yeah, so what about that one, guys? Question number 4. Where is it mentioned? Transmission of the disease condition or mechanism. Here it means how it is transmitted. And it can be transmitted through how it is transmitting. Yeah, very good, Nimmi. This can enter the body when soil containing Balimatiae comes in contact with skin, wounds, as well as cuts. So yeah, that's all about how the transmission is going on. So that is answer is from text A. Then, fifth one. How many right answers? 1, 2, 3, 4, 5. Yeah, very good, very good. Yes, Shaimol, Anju, Neethu, Sistilin, Anju, Agnes, Anu, Shanu, Nimi. Yeah, very good. Fifth one. Cases diagnosed using initial testing. So, cases, diagnosis, testing. Where is it mentioned? Diagnosis mentioned in text C. We know that. But don't ever conclude that it is text C with one keyword. One keyword allallo nammal underline cheyide. We have underlined 3 keywords here. So from diagnosis, maybe it is from text C, but we have other words here, keywords here. Cases, diagnosed, testing, initial testing. Where is it mentioned? Yes, Neha, Kavita. It was text A. And what about fifth question? Cases, number of cases, diagnosed, initial testing. Yeah, see, 111 cases diagnosed by first line testing exactly from D. So, answer is D. Clear? Yeah, how many correct answers? Yes, Shanu. Anu Thomas is still in. Yeah, it was text D. Sorry, Agnes, it is no text A here. It is from text D. Cases diagnosed, initial testing. See, it is here. E box on Udeshkinekanda. So that is from text D. Then sixth one. Where did the amoeba manifest its presence for the very first time? So my keywords: amoeba, manifest, and presence. എവിടെയാണ് ഇതിൻ്റെ ഫസ്റ്റ് പ്രസൻസ് വരുന്നത്? So the presence of the, so all about this amoeba and what is the condition is mentioned in text A. So I'm damn sure that it is mentioned in text A. See the first line, free living amoeba found in the environment first. See, ആദ്യം കാണുന്ന environmental എന്നാണ് അവർ പറയുന്നത്. So answer is mentioned in A. That's my answer. How many right answers? Yes, Anju. Sorry dear, it's not B, it's A. Okay, sixth one ആണോ? Sixth one A അല്ല, A ആണ് കേട്ടോ. It's not B. Seventh one. What factors rendered certain cases ineligible for further classifications? Again, factors. Ineligible, not eligible. Classifications. Classifications of cases mentioned in text D. And ineligible cases, where is it mentioned? So I'm going to check ineligible cases mentioned. In the first box, it is all about exclusions. Suspected encephalitis. Unknown etiology. See? Okay. So unknown etiology as well as, yeah. So here, they've mentioned about that. And here as well, 65 cases excluded by case definition or as non-encephalitis. See? So that answer is from text D. Okay, answer is mentioned in D. So let me know in the comment box, anyone scored 7 out of 7 for this part A? 7 out of 7 score ചെയ്തിട്ടുണ്ടോ? എത്ര പേര് സ്കോർ ചെയ്തു? സോ എവറി ഡേ വെൻ യു ഡു എ മെറ്റീരിയൽ യു ഹാവ് ടു ചെക്ക് യുവർ സ്കോർസ്. എത്ര സ്കോർ നമുക്ക് കിട്ടി? ആൻഡ് വി ഹാവ് ദറ്റ് കൈൻഡ് ഓഫ് ഈഗർനെസ് വിത്തിൻ അസ്. എത്ര സ്കോർ എനിക്ക് കിട്ടുന്നുണ്ട്? വെദർ ഐ ഹാവ് എനി ഇംപ്രൂവ്മെൻറ്റ്. ക്ലിയർ? Yeah. Very good, Sistilin. Answer is from text D. Yes, Kavita. Very good, Anu. Excellent, as always. Okay. Yeah, so I'm just jumping to the next question, which is question number 8. What is the longest incubation period for the persistent GAE symptoms? And my keywords: longest incubation and symptoms. Or you can underline longest period. Period നിങ്ങൾക്ക് വേണമെങ്കിൽ അണ്ടർലൈൻ ചെയ്യും. So whatever it is, you can underline 3 words. But those three keywords should help you or will help you to identify the answers. Yeah. So what about 8th one? ഒന്ന് comment ചെയ്തേ. Very good, Sistilin. You got 7 out of 7, right? Yes, Nimi. It's good. It's okay, dear. 6 out of 7. It's a pretty good score. Yes, Anju. Pretty good. Very good, Kavita. As usual, അല്ലേ? Very good, very good, dear. കവിത എക്സാം ഡേറ്റ് എടുത്തോ? എത്ര പേര് എക്സാം ഡേറ്റ് എടുത്തിട്ടുണ്ട്? Yes. So, what about 8th question? What is the longest incubation period for the persistent GAE symptoms? ഒന്ന് comment ചെയ്തേ. Longest period. Incubation. Symptoms. So, symptoms mentioned in text B. And what are period, which means some kind of numbers definitely will be there, right? So I'm just searching for numbers here, first, second line, and a lot of symptoms mentioned. And here some numbers, see, develop over a period of several weeks to as long as 2 years. So what is the total, longest period here mentioned here? 2 years, right? So my answer is 2 years. Okay, answer ഏതാ വരാ? 2 years. It is not year, years എന്നല്ലേ പറയുന്നേ? Yeah, years. So don't write 2 year, it is 2 years. Yes, still in Anju, it's not year, dear. Sneha, it's not year, it's 2 years. Okay, ഒരു spelling mistake വന്നാലും they will not give you the marks. So 2 years. Ninth one, which technique detects antibodies against Balamithia amoebas in infected patient serum? So technique, antibodies and serum. I've seen this word serum in only one text. അത് ഒരു ടെക്സ്റ്റിലാണ്, I think so, I don't remember exactly, yeah, the word I've seen. And അതെവിടെയായിരുന്നു നമ്മൾ കണ്ടത്, the word serum? I think in this particular text, diagnosis എവിടെയോ ആണ്, I've underlined the word serum. So yeah, where is it mentioned? Something called serum of infected patient. കണ്ടോ? See here, already I've underlined that word. Yeah. And which test is related to that? Indirect immunofluorescence assay or IFA is a test used to detect antibodies. Another keyword, kanda, developed against Balamithia amoebas in the serum of infected patients. So that answer is IFA. So either you can write the abbreviation because it is already mentioned there, or you can write the full form. Both are correct answers. Clear? So that's that. So answer is IFA mentioned in text C. Yes, Shanu, Agnes is still in. Very good, very good. Right answers. Yes, Agnes. Yes, Nami. That is IFA. 10th one. What remained anonymous in the cases of confirmed encephalitis? And 10th one, anonymous cases. So number of cases definitely mentioned in text today. I have no doubt regarding that. Anonymous ആയിട്ട് നിൽക്കുന്ന cases എത്രയാണ്? Unknown cases. So it's not, they're not asking what is the anonymous cases, what remained anonymous in the cases of confirmed encephalitis. It's not about how many cases are there. എന്താണ് അവിടെ anonymous ആയിട്ട് നിൽക്കുന്നതെന്നാണ് question. So what is anonymous there? Unknown etiology. So anonymous is etiology. So answer is etiology from text D. Etiology. Clear? 11th one. Since the detection of new species of amoeba, what is the reported number of B cases? So reported number and the new species as well. So I'm just underlining new. Clear? So what is the reported number? Again, we need a number here. എത്ര cases ആണ്? If the question is how many or how much, you can just write the number there. ആ number മാത്രം എഴുതിയാൽ മതി. But here the question is what is the reported number? So that you can write less than 40, more than 40, whatever the number. Along with the number, you can add a preposition. Yeah. Okay. So I think it is mentioned in text A. Approximately എത്രയാ വരിക? Which is mentioned here, more than 200 cases of infection have been diagnosed worldwide. So answer is more than 200. More than 200 is the correct answer. More than 200. 12th one. Through metagenomics and next generation sequencing, what insights can be gleaned from analysis of 36 of cases? Clear? So my keywords, metagenomics, next generation, 3. And where is these particular keywords mentioned? ഈ keywords ഒക്കെ എവിടെ കൊടുത്തിരിക്കുന്നത്? Metagenomics. And I've seen this keywords here in text D, right? Metagenomics, pathogen, next generation sequencing. കണ്ടോ? So it's all about എന്തിനെ പറ്റിയാണ് ചോദിക്കുന്നത്? So the keywords mentioned here in text D. So what is the correct answer? I think this is the correct answer. Pathogen discovery. Ano? Yes, still in Shiny. Sorry, Shymol, Nimi. Yes, Anju. Kavita, it's not 92 dear. It's more than 200. Yeah, so we were discussing about 12th question. So answer is pathogen discovery. Pathogen discovery is the correct answer. And discovery, which is mentioned in text D. 13th one, the fatal outcome resulting from this infection, infection, affecting the brain and spinal cord is termed. So outcome, brain, spinal cord. ഇതൊക്കെ എവിടെ കൊടുത്തിരിക്കുന്നത്? Brain, spinal cord. So where is it mentioned? The brain, spinal cord. The fatal outcome resulting Balamataia mandrillaris infection affecting brain and spinal cord is termed. On the comment Yamo, what is your answer? 13th one. Fatal outcome resulting from this infection affecting the brain, spinal cord is termed as. The text on the comment. A very easy question. So where is it mentioned? In which text it is mentioned? It is mentioned in text A, as you can see here. Either you can write the abbreviation GAE or you can write the full form granulomatous amoebic encephalitis. Okay, very simple answer. So I'm not gonna explain it so far. So yeah, it is GAE. 14th one, where could we find the presence of this infection, B infection DNA by conducting polymerase chain reaction? So where? DNA polymerase. എവിടെയാണ് ചോദിക്കുമ്പോൾ we need a preposition there that indicates the exact position. Okay, and I know that the answer is brain tissue. Is it only brain tissue? Brain tissue എന്ന് മാത്രമാണോ നമ്മൾ എഴുതണ്ടേ? Answer is mentioned here in text A, I think. And somewhere here. In one of the courses, it is one of the causes of serious infection of the brain of spinal cord and here. So where is it mentioned? On the comment ചെയ്യാമോ? I find that answer here. എനിക്ക് ആൻസർ കിട്ടുന്നില്ല. നിങ്ങളൊന്ന് പറഞ്ഞു തരൂ. Where is it mentioned? Yeah, answer is brain tissues, I agree. But my question is, where is it mentioned? I don't know where is it mentioned. നിങ്ങളൊന്ന് കമൻറ്റ് ചെയ്തേ. എനിക്കത് കിട്ടുന്നില്ല. I thought it is mentioned in text A, but it's not. പിന്നെ എവിടെയാ? Where is it mentioned? Is it in text A or in other text? എവിടെയാണ് മെൻഷൻ ചെയ്തേക്കുന്നത്? So I'll just give you the answer. Answer is brain tissues, but not only brain tissues. Where could we find the presence of DNA, this infection DNA, by conducting polymerase chain reaction? Where is it mentioned? On the comment AMO. Yes. Answer, I agree, that is brain tissues. Okay, brain tissues. And so answer is brain tissues, but where? In the brain tissues or on the brain tissues, inside the brain tissues, what is this preposition mentioned in the paragraph? On the comment ചെയ്യാമോ? Yes. So now I'm just moving to next question. So please do comment. Okay. എന്താണ് where എന്ന് ചോദിക്കുമ്പോൾ എവിടെ exactly that preposition should be there. Okay. So ഒന്ന് comment ചെയ്യണം. 15th one. Amoeba infiltrates the brain and causes GAE through. So amoeba, then brain, and GAE. Okay, it's not important to underline GAE, but anyway, I'm just underlining the word also. And answer is bloodstream. Okay, so where is it mentioned? Bloodstream. So here, the Balamataia amoebas can travel to the brain. See keyword, through the bloodstream, can cause GAE. Another keyword. So answer is bloodstream from text A. 16. AIDS physicians and scientists in diagnosing Balamataia DPDX and FLIA laboratory dash provides assistance. Very clear-cut question because I know the keywords mentioned in text C. It's all about diagnosis. So the keywords mentioned here, I think in the last paragraph, CDC, right? Offers diagnostic assistance. So dash offers assistance. So very direct answer CDC. Answer is CDC. Physicians, scientists, DPDX. See? So answer is CDC from text C. 17. Discovery of the amoeba initially occurred in the brain of deceased dash in the year 1986. So my keywords discovery, initially, 1986. And where is 1986 mentioned? I think it's in text A. I've somewhere seen here. Okay, 1986. Yeah, it's here. 1986. And what is related to 1986 mentioned here? The amoeba was found in the brain of deceased, that is dead ആണ്. So answer is mandrill baboon. Okay, mandrill baboon is the answer, which is from text A. So mandrill baboon. Please do check the spelling also. Okay, that's in text A. Then 18th one. B infection likely enters the body through contact with dash containing it, reaching skin, wounds, cut, or by inhaling or ingesting dust. So these all things mentioned in again text A. അപ്പോൾ ഇവിടെ മിസ്സിംഗ് ആയിട്ടുള്ള വേർഡ് ഏതാണ്? A lot of methods of infection transfer or transmission is mentioned here, so that it can be transferable through എങ്ങനെയൊക്കെ ട്രാൻസ്ഫർ ചെയ്യുമെന്ന് പറയുന്നുണ്ട്. സ്കിൻ, wounds, cuts, or when dust containing, right? And where's the another way? It's through soil. Soil containing. So answer is soil from text A. Correct ano answers? Yes, Nimi. Very good, Anju. Yeah, so answer is mentioned in text A. So that is soil. 19. Frequently fatal. GAE exhibits a dash nature with symptoms manifesting over a span of 2 years. So exactly 2 years നമ്മൾ already കണ്ടതാണ്. And symptoms already we have seen there. So that was in text B. Symptoms as well as exactly over 2 years. And what is the missing word there? 2 year കൂടുന്നത് എന്നാൽ it's called what? Where is the answer mentioned? GAE is chronic and symptoms develop over a period of several weeks to as long as 2 years. So answer is it is chronic. So that is the missing word. So which is chronic. Answer is mentioned in text B. So I'm just moving to the final question, and one reminder, this one, where? Okay, so 20. After receiving expert review, dash 17 cases of unknown etiology underwent diagnostic procedures promptly. So unknown cases mentioned here in text D, and 17 cases, diagnosed, expert review, panel advice, right? So what is the missing word here? I think it is panel advice, because 17 mentioned aana, diagnosed mentioned aana. So that answer is panel advice. So my answer is panel advice from text D. So that's all about today. Clear? So let me know in the comment box. A lot of comments here. I'm so sorry that I couldn't read your comments, but whatever it is, okay, I'll just check your comments and definitely I'll just reply to your comments. Yeah, so anyone with 20 out of 20? 20 out of 20 in the comment today. So that's all about today. And I'll show you guys on Wednesday. So please do continue your preparations and just prepare well, do hard work and smart work. So that's for today. Thank you. Take care. Bye.